Dr. Auerbach.
How are you?
I am well, thank you. Good afternoon, good evening, good day, everybody. Welcome to Dental Voice, our second season with Zyris. My name is Rolando, and we're excited because we're about to start off a new season of Dental Voice. When you look at Dental Voice, the purpose of this show is to get feedback from clinicians and understand their experiences and get advice from them. So today we have a really special guest. The thing that we're trying to figure out is how to separate reality from fiction. So we've got Dr. Jason Auerbach, who is also known as the Bloody Tooth Guy. And I wanted to spend some time with you to understand kind of where you're coming from, things that you're experiencing and all that. So first of all, thank you so much for joining. Really, really appreciate it. It's great to see you.
It's great to see you too. Thanks for having me.
Awesome.
It really
it's like
nice
Avatar.
Thank you. Yeah.
So I'd like to start, first of all, by just understanding kind of your experience and how you ended up becoming an oral and maxillofacial surgeon.
So, for me, oral maxillofacial surgery was something that I fortunately happened upon. I didn't go to dental school thinking I was going to become an oral maxillofacial surgeon. I went to dental school thinking I was going to go into cosmetic dentistry and work and live in New York City and have this great existence. And it bit me. It bit me probably second year of dental school. Just kind of found myself in the oral surgery clinic and realized that I had an aptitude for it and quickly developed a passion for it and never looked back.
So you are in dental school, you're looking around, and you end up coming into this, and you're like, holy cow, what was it about this that bit you? I'm curious.
It's difficult to put your finger on it, put my finger on it. For me, it was something that was entirely different than anything I had experienced within dental school. Up to that point, it was really all about, I felt, a lot of minutia, a lot that I wasn't really too keen on. But when I went down there, it was using your brain and your hands and figuring things out. And it was, for me, just a different level of care, a different level of clinicianship, if that's even a word. But that's basically how I felt about it. I thought it was great in every way, and I'm not really being very specific about it, but it was clearly special, clearly different, and I'm so fortunate to have found it.
No, it's incredible. When I look at the videos that you're posting and the kind of the detail and how exquisite everything is, it's amazing. Was that something that you kind of in the back of your head wanted to do, or was it something that you kind of stumbled on and just all of a sudden decided to do?
It's interesting. So looking at it now, when you're looking at Instagram, there's so much video and so much emphasis on the story rather than on the feed. But when Instagram started and when I started on Instagram, there were no videos. It was all still photos, and for me it was simply photos of bloody teeth at the time. And then as Instagram evolved, so too did my account, and I was fortunate to kind of be ahead of the curve relative to other oral surgery and dental Instagram accounts. And from that point on, it was really just it was really just kind of seeing where things went, experimenting, what works, what doesn't work. And so no, I didn't plan on it when I started I wasn't filming surgery. Now that's basically all I do.
It's so cool because in addition to the kind of things that you're doing, the procedures and the depth that you get into, I mean, they're absolutely incredible, and I so much appreciate it, and it kind of blows me away. So you clearly have a passion for it, and so have you had like medical or dental in your background, or is that something that you pursued? How did you end up here?
So for me, I really didn't. I was always entrepreneurial, and I really didn't know how I was going to make the life that I wanted to live ultimately. And I have a very, very close friend who is my college roommate who introduced himself to me on day one of undergrad. And his father was an orthodontist. I had had some really positive experiences with dentists when I was younger. And I really didn't have a lot of guidance as far as what I was going to do. And thank you. And because I didn't have a lot of guidance, it was really, I kind of figured out my own way. And I found that I was kind of inspired by certain people that I met, those dentists and my friend's father, and found myself in dental school. I worked as a dental assistant for a prosthodontist while I was in dental school. And again, I totally thought I was going to cosmetic dentistry. And then I came across an oral surgeon who was also working for her, who I thought was crazy to do the extra years, but thank God I met that guy, and the rest is history.
And you love it, and you're not looking back at all.
Not at all. Not at all. I've been doing it a long time. There's no looking back now.
You know, I have a special kinship to you because you founded and started Riverside Oral Surgery, and now you have how many? Four
offices, about to have a couple more. So yeah.
So in this whole experience and the kind of the pandemic that we're dealing with and all that type of stuff, how has that hit you, and kind of what's the experience that you and your colleagues and your team are dealing with so far?
You know, it was really tough. It was really tough for me emotionally. I started my practice from zero, and I have multiple people who are with me from those first days, from pre-Riverside Oral Surgery, and I built it into, we as a team have built it into something that has been pretty special. And having to furlough people in the early moments of this, not really knowing what was going to happen, and really obviously this took a lot of people by surprise. I was very fortunate, I think, due to my presence on Instagram, to have had a little insight, a little bit of like a heads up from some of my colleagues who were going through it a few weeks before we were, especially in Italy and Spain. And so because of those friends, I was able to kind of get ahead of it. I knew what we needed to do as far as PPE, as far as protocols. I kind of anticipated what was going to happen in terms of shutdowns. And then as we emerged from just emergent care to urgent care to elective care. And now, fortunately, we have all the procedures and protocols in place. We have amazing technology. We have the right people. People came back, and right now, thankfully, New Jersey is still in a really in a good situation, relatively speaking. So as long as we can stay here, and even if we don't, we'll be ready to do what we need to do.
Wow, it's amazing when you think about this pandemic and how it's completely shut down. We're talking globally. There's so much information, and we're hearing so many things from so many different places. You personally, how do you kind of filter what's just pure speculation or people kind of freaking out versus what's real?
So factually, I try not to watch the news about it. And I try to listen to experts. I mean, science is science, and this science is evolving, of course. But you look at the human experience, and you know that we're all sharing the same human experience. So what's going to happen in Beijing 4 months after we have a reopening there? It's likely to happen here. I mean, right. We're human, and probably to a greater degree, right? I mean, unfortunately, we see what's going on in Florida. We see, things kind of rolling back in California, unfortunately. Yeah. And, for us to think just because we're like Jersey proud that we're not going to have the similar experience, that's crazy. So I think ultimately we have to be prepared for what is likely to occur. And, I try to use my brain. I'm a pretty practical guy, and I try not to let my emotions get the best of me. I will say they did definitely in the early month or so, but now it's just a matter of like being prepared, doing what you have to do, understanding what's likely to occur, and being able to pivot. So we're a large practice now, but we're really nimble, and we're able to be nimble because our team and the people around that we surround ourselves with are that they think progressively, and they're like, okay, where are we going to go? I mean, we are already thinking about what's to come. So
That's cool. Thank you for that. And it's quite amazing. It's amazing too that you were able to kind of get feedback and advice from some of your colleagues or some of the friends over there, so that it sounds like you kind of got a heads up before any of this happened. So there was, you kind of already kind of knew, right?
I did, and I mean, I was talking to people. I did a live with an oral surgeon from Italy. For us, they were in the throes of it, and we were not quite yet. And I was like looking to give her an opportunity to speak, and she did, and it was unbelievably insightful, and I'm very happy that we did that. And then subsequently, you know, we took that kind of perspective, and we were able to help our referral network, which, you know, in my business is everything, right? So that's being able to be the voice and being able to kind of guide people, whether it was about the virus or the financial side of things or different protocols that we had to put into place, you know, where to get face shields or where to get sneeze guards, you know, these acrylic screens that we have in front of the reception area. You know, it's funny that just as it relates to that, you know, when so I've acquired a few offices, and as I do, most of these offices were like a little bit antiquated. And so we all went to this kind of open floor plan, open reception area. Everyone is just kind of all over the place, not really all over the place, but just
spread out.
And now, as I look to build these next two offices out, I almost feel like we have to go back to a time where there is that divider, like not the doctor's office and you come in and like whatever, but exactly like where there is some sort of transparency, literally, but also a blockade. So I don't know, I'm trying to figure that part of it out right now too.
Wow. Was there, you know, we've been hearing from quite a few folks all over the place that some of the teams are having apprehension coming back because of the potential for infection. And you mentioned early as you were explaining it, your team wasn't that way. How did that happen? How were you able to accomplish that with them?
Well, I don't know that they weren't that way. Some people had apprehension, totally justifiably, and I think some people are still apprehensive. You know, look, I was doing everything I could do to protect the people who work for me.
Right.
That was the paramount thing. That was the number one thing. So I was driving here and driving there, trying to procure whatever I needed to do, and I was doing what I thought was the right thing to do, and my partner as well. And I think that, you know, people who work for us know that, and so they trust us, and they trust that we're putting their best interests ahead of everything, because I mean, we're working side by side with them. They're everything. Without them, they're zero. So, you know, I think that there's got to be a trust level there, but I think apprehension is real. I think, you know, especially team members who have elderly parents that they care for, or young children, or they themselves are a little bit older or medically compromised, and we're seeing now that it's really not just you know, just older people who are getting sick, but many people, unfortunately. But the fact is as long as you do what's right, I mean, we were never, when we were allowed to see emergencies, we were seeing only emergencies. We were not trying to like do more to get a little bit more. We were really following the guidelines that were set forth by the governor of the Department of Health, CDC recommendations, American Association of Oral Maxillofacial Surgeons. They were great. Governor Murphy has been he's been good. You know, it's interesting. He's been good. I've been very happy. So I don't know if that just gave away a little bit, but I mean, the fact is that it's been we're just doing everything we can.
No, I love that. What's really cool is and the sentiment, and tell me if I got this, is you were very direct with your team. You weren't kind of feeding them, and you respected the apprehension that people have, and not trying to say it's not a big deal. And I think that goes a long way to establish trust, establish a connection between you, and I think that's pretty cool. It sounds like you have a really strong connection with your entire, I mean, it's your entire team, right?
Yeah, I mean, I try to, as you grow, it becomes more difficult to have those personal relationships with everybody. But, someone's asking, how do we accomplish trust? I mean, trust takes time. You just got to build trust over time. There's no shortcut to it. You can't buy it. You can't force it upon anyone. You build trust over experience. And people know that they can trust you only after they see that they can trust you. So, I think that I just value the people who work for me. I expect a lot. I'm not like, all peace and love, but I mean, I am peace and love, but I expect a great deal. I'm a crazy perfectionist, but I think the people who work for me know that they're going to get love and support from me, and I'm going to expect from them greatness. And that's what it is.
Yeah, that's awesome. It's one of those, yeah, all you ask is for them to deliver on their commitments, it sounds like. And when they do, you're there. So I love this perfectionist piece, because in watching the videos that you post, and I also like the fact that some of them, you have the little disclaimer basically saying, hey, this could potentially be a little disturbing. So for those of you who are not clinicians or whatever, don't click on this because it's going to be gnarly. How do you just videotape, or do you just kind of every one of the cases that you have? How do you pick which ones you post out there? How do you do that?
I actually video too few of the cases that I do. So it used to be that I would have my office manager, who started out as an assistant, then became reception, and then now is my office manager in the office that I practice out of. I used to have her do a lot of the recording. And then I actually have an undergraduate student right now who cold DM'd me out of nowhere and was like, I live in this town that happens to be close to my office, and I will come and I will work for you and I will do whatever. And I was like, yes. And so she's there now, and she's recording, and she's great. But first of all, not every patient wants to be recorded. Not every case is that interesting. I mean, much of what I do is kind of like the same thing, right? I do a lot of wisdom teeth, a lot of dental implants, a lot of extraction bone graft, a lot of pathology. So I do the gamut of, contemporary oral surgery, private practice kind of oral surgery. I don't do much by way of hospital work anymore, but my recording is done by an awesome undergraduate student who wants to be an oral surgeon, which is great.
That's so cool. So going a little deeper here, and everyone is talking about aerosols and this virus and how it's beyond bloodborne. Now it's aerosol-borne. What are your thoughts on that, and how do you minimize, and how do you manage that during the course of your procedures, especially in the kinds of procedures you're doing?
So that's totally fair. So each room is outfitted with air purification system, hyper-HEPA filtration, and so the baseline is high airflow turnover, and then we have these extraoral aerosol suction units that we use and turn on, which creates the appropriate suction to that area outside of the patient, almost above their head. So any aerosolized virus actually is, to a certain degree, suctioned. To be frank, I don't know. I know that does a fair amount. Like, it does a good job. I see it. I can see the aerosol, the fluid going up and into it. Science-wise, I don't know, honestly, how effective that is. There's a lot in terms of foggers There's UV light in the returns, that type of stuff that's being done all over the place. I think the jury's still out on what the best way to control that is. I really do. I think there are tons of great products out there and protocols and systems, but I do think that we will learn over time how to best handle it. Much like, you know, the way I see this is, you know, what HIV, AIDS, hepatitis C did for bloodborne pathogens, universal precautions in the 80s, this will do for airborne protocols. I mean, TB was a real thing 50 years ago, and this is a real thing now. So we have to figure it out. I think as fewer and fewer people are presenting COVID positive, it's less of an issue, but we have to treat everybody like they are COVID positive.
Wow. So in with regard to all this technology that you're using, how do you and your team make the decision? And you know, you've mentioned multiple things that you're doing. How do you make those decisions? What advice would you give other people who are sitting back and trying to wait to see which one works? I mean, how do you go through validating that, and then, you know, what advice would you give people to what to use?
Well, so I think the first thing is to really tighten up your procedures and your protocols as it relates to sanitation and all of that. I think that's the number one thing. I mean, dental offices, when you go by the book and you do what you're supposed to do, are very clean places, right? I mean, you're cleaning the countertops, you're cleaning the chairs, you got all the wraps on the headlights, on the hands, on this and that. Everything is clean and everything is appropriately disinfected and sanitized. So as long as you're really kind of doing those things that you should have been doing all along, for the most part, you're okay, right? All the surfaces really should be clean. That's it. How do we handle the aerosol? You know, I think aerosol control, like what you guys have in terms of intraoral stuff, and I think the extraoral suction, I think air filtration, I think there is potentially a role in terms of, you know, turning the air over, you know, air quality type of stuff. I was thinking a lot about negative pressure rooms when I started, like when this started, I should say. I don't know. I mean, I understand it a lot more now. I just think, I don't know that that's the right answer. It's certainly expensive, cumbersome, and probably unrealistic to expect most dental offices to convert to that. But I think that there are smart engineers out there who are designing HVAC systems, you know, whether it's with UV filtration in the returns or whatever, that we'll be okay. It's just a matter. I mean, if you look at it now, have you seen, I don't want to like jinx us as a profession, but we haven't really seen large scale dental office exposure issues, right? And even in states like Texas or Georgia that really haven't really kind of shut down in any appreciable way, there's really not like a whole office turns positive. I mean, that doesn't happen. Why? I don't know. Maybe it's not as, maybe we're doing a good job.
Well, when you think about it, when you look at dentistry has always been very focused on infection control, on PPE and all that type of stuff. So plus you get to choose which patients you treat. If a patient is exhibiting symptoms, you say, hey, come back in 14 days because
that's right.
You know, what a bit. So I think that's so cool. Yes. From a practice perspective, you know, we've heard, you know, there are some practices that are struggling, and you mentioned that you're looking at potential expanding. Are you seeing that, or is it making it I don't know, easier or to reach out and maybe help out some of these other practices, or even bring them into the fold for Riverside Oral?
Yeah, I've maybe had some trouble with the current situation. I mean, everyone has had trouble with the current situation, but it's much more difficult to manage it I think when resources are scarce, or your connections aren't there, or you're not, I mean, just be frank about it, if you're not really a high priority practice for dental distribution company or whatever, it's difficult. I mean, very, very difficult to manage that kind of stuff. And so being part of something that's bigger, something maybe that has a little bit more more ability to kind of handle the things that come our way on a larger scale, I think is helpful. And I think guys who are at the end of their career, for many reasons, want to become part of something bigger, an exit strategy, just kind of like, you know, legacy planning and things like that. Thanks, Ben.
You know what? I don't have any of that. No, first of all, joking aside, that the sentiment and the support there, I think that's really important, because it maintains the integrity of the patient base. The treatment is there. Plus, you're right, with the resource that you have, you're able to kind of weather the storms bigger. So if I hear it correctly, what advice would you give other clinicians, you know, with regard to how to weather this and keep going right now? We've got a lot of you've got a lot of listeners.
I mean, I think you want to differentiate yourself as somebody who is proactive and who's paying attention to what's going on out there. I think you have to stockpile to some degree. I'm not talking about necessarily taking anything away from healthcare workers in the front line. That's wrong. But I do think you have to think about your practice and what you need over the course of the coming months. I think from not just from a PPE perspective, but from a cash flow perspective as well. I think when maybe you would keep X in the bank on a typical month. Now you got to really think, like, if things shut down again and you need to pay your rent and pay your team for 2 months or however long it's going to be, you got to be prepared for that. So, you know, distribution of profits is a different, I mean, not everybody deals with that, you know, the way that we do, but you know, that's a real thing. I mean, we have to think about keeping more money in the business and keeping everything kind of ready to go. We just have to be able to handle things that come our way. And the only way to do that is to be prepared, you know?
Yeah, I love the advice. That's great. Final thing, if you were to send a message out to patients or your patients, what's the message that you'd like to get out to them?
From what I'm saying?
From you, from your team, from your office.
I appreciate that. Yeah, I mean, we are all about patient safety. So I founded my practice in 2007 with this concept of the optimal patient experience, of creating the optimal patient experience, and we live it every day. I think the optimal patient experience has changed from this, you know, boutique service-oriented concept, which is still at the baseline of everything we do, to highly focused on infection control procedures and safety measures and things like that. So patients have always had choice, and I think, you know, a generation before us, the practitioners weren't so aware of that, or maybe they didn't have to be so aware of that. But now patients have choice, and I think where there's an opportunity to differentiate yourself in terms of what you're doing for your patients, we lead. So Riverside Oral Surgery, in my opinion, I mean, I don't know why you'd go anywhere else.
Oh, that's awesome. And based on the work that you've done, based on the things that you do, what is it? People don't care how much you know until they know how much you care. And I love the passion that you have in the way you attack things, with regard to the kinds of things that you're presenting and how, you know, Bloody Tooth Guy, who would have thought it? I think it's fantastic. And I'm so, first of all, I'm thrilled that you were willing to spend some time with us. I know it's almost, 8:30 your time. You've had a long day. So I don't want to keep you much longer, but I do want to thank you for taking the time, sharing your thoughts, and basically just, you know, being who you are. There's a genuineness to the things that you do. And maybe it's because you're from the East Coast and you just say it how it is. I like it.
Keep it real. Always keep it real. But I appreciate what you're saying. I really do. Thank you.
Yeah. Well, thank you so much for joining us. If at some point here, maybe would you be up for hanging out with us again a little bit later?
Absolutely. No question about it. I'd love to come on and talk. I appreciate the opportunity for sure.
Oh, thank you. So those of you who joined us, thank you so much. This is Dr. Jason Auerbach. He is an incredible oral and maxillofacial surgeon. He is the bloody tooth guy. If you haven't already, he's on his Instagram channel. He's got some incredible cases. He also has, there's a kind of humor there that's pretty cool. I think it's kind of East Coast, but I kind of like it. This is Dental Voice with Zyris. My name is Rolando. This is Dr. Jason. Thank you so much for joining us, and I look forward to spending more time with you and getting to know you even better.
You too. Thank you so much for everything.
You take care. Have a great evening. Please be safe.
Definitely.
And, really
you too. Take care.